This case, I'm just a little bit worried about your oxygen saturation right now. How are you feeling?
Not so good. I'm a little bit short of breath.
Okay, well, I'm just gonna turn up your oxygen level and then take a listen, okay? Just
Okay.
1 second. I'm gonna turn it here from 2 liters all the way up to 6. And take a quick listen. See if that makes you feel any better, okay? It sounds about the same to me as it did earlier this morning. Are you feeling any better?
Not really, no.
Well, we really haven't had much of a change in your oxygen saturation, so I'm going to call the doctor. I'll be right back, okay?
Okay.
Yeah. Hey, Allison, I got your page. What's going on with Miss Case? Hey, Miss Case. Dr. Knudsen. Miss Case is hypoxic. And as you probably remember, she's a 48-year-old woman who was admitted with community-acquired pneumonia, and she has been on 2 liters nasal cannula and satting fine. But this morning, I came in and her saturations were low, and I needed to increase her nasal cannula to 6 liters, and I really haven't had any improvement.
Okay. What time did you turn it up?
I turned it up right before I called you, so it's been about maybe 10 minutes.
Okay, sounds good.
Hey, Miss Case, I'm just going to take a quick look and listen here. Before we get started, I'm just going to elevate your head a bed. Sometimes people feel less short of breath sitting up, okay?
Okay. Thank you.
You let me know if it goes up too far. Is that okay?
Oh, that's been good, yeah.
Good. I'm going to check just to make sure the oxygen is all connected. Sometimes there's a real simple fix. Oh my goodness, it looks like it was a little bit loose. We might have been leaking some oxygen. I'm going to put that back together here.
Thank you for noticing that.
Oh, absolutely. That's happened to me before. Otherwise, it's not something I always think of, but I usually go wall to patient or patient to wall to make sure I don't miss anything.
Got it.
No, it looks like our saturation's a little bit better, Miss Case, but they're coming up slowly. So, Allison, would you go get me a non-rebreather while I take a listen to everything? Miss Case, I'm just going to take a look and listen to you here. I notice your lips are just a little bit blue. I think that oxygen level's been low for a little while.
Yeah, I still don't feel very good.
Don't feel very good? And it looks like you're breathing fast.
Yeah, I just can't catch my breath.
Both sides of your chest are rising nicely. I'm just going to take a quick listen here. I don't see any accessory muscle use. Okay. We'll just put that non-rebreather on when Allison gets here with it. Oh, great, thanks. Have you used these often?
It's been a while.
I find sometimes that people forget what to do, so we have to make sure this reservoir bag is all the way blown up.
Okay.
So that there's oxygen circulating. Just doing a little explaining here, Miss Case, as we're going along, okay? And we have to be at 10 to 15 liters per minute as well. So I'm going to turn the oxygen up. Probably feels funny on your nose. Sorry about that, Miss Case. I should have warned you. Good thing Allison is here to work with me. We're going to blow this bag up.
I see what you're talking
Just
about.
have to kind of cover the inside so it inflates.
I don't think I would have done that. Thank you.
Uh-huh. And then I'm going to just get this draped over, a little mask on your face. I know that plastic smells funny here, Miss Case. Just going to get that behind your head.
Thank you.
Sure. So I'm a little concerned, Miss Case, when I look at how quickly we've had to go up on our oxygen level today. And no problem. When the rapid response team gets here, I'm going to be telling them the same things we just talked about, and I will talk to your family about that as well.
Thank you so much.
You're very welcome.
Okay.
Hey, I'm Dr. Donnie with the RRT team.
Hey, I'm Nancy. I'm the intern on this
Nice
service.
to meet you. What's going on?
And this is Allison, our nurse.
Hi, Allison.
I'm concerned my patient's hypoxic.
Okay.
This case is a 45-year-old woman admitted earlier today with community-acquired pneumonia. And over the last 6 hours, she's gone from 2 liters nasal cannula to 100% non-rebreather. And her oxygen level is not really responding.
Okay. Can I help with anything right now?
Well, I think that she needs to go to the MICU, but I wanted another piece of advice since, this is just my first month.
Okay, I'm gonna take a listen to her breath sounds and let's chat in just a second, okay?
That would be great. Thank you so much for coming.
Mrs. Case, I'm just gonna listen to your lungs, okay? Take a couple deep breaths for me. So I noticed some decreased breath sounds on the right. Is that consistent with your exam?
Yeah, that's what I'm hearing too. I don't hear any wheezing, but I'm just afraid that pneumonia's getting worse.
Okay, do you think she's stable to transport right now?
Well, I don't know, and that's the other thing I need help with. Her SATs at the most have been 94, and now they're down more like 86, and it's a long way over the DMP. What do you think?
I would trial her on some BiPAP. Do you think that's like a good idea?
Yeah, I think that would be a great idea. Miss Case, that's what we were talking about earlier. I think that we'll try that BiPAP since you're awake. It's safe to use and kind of re-expand those lungs a little bit, okay?
Okay. Is that
Okay.
the invasive one?
The non-invasive one, that's
Okay.
right. That's right. Great job listening and remembering. Jack from Respiratory is going to help us get it hooked up here, okay?
All right, just pardon me, ma'am. I'm just gonna come right in here.
And if that is doing well and stable, then we're going to move to the intensive care unit, and we'll be sure to let your family know because they're on their way.
Thank you.
Okay. All right. Just try to take some deep breaths. We're going to work to adjust it some with your breathing. I think maybe we can do like 10 over 5 to
Okay.
start. I know it's kind of hard to talk with that on. Are you feeling a little better, Miss Case?
Yeah.
Okay. Okay.
Do you think, are we ready to go?
Try to take some slow, deep breaths. Yeah, I think so. We've got the travel BiPAP. Things look good, Miss Case. We've got some hands. Do you guys mind helping us move to the unit?
Let's do that.
All right. We're going to just head on over to the MICU.